Fatal cerebrovascular accidents post-AstraZeneca novel COVID-19 vaccination in 2 patients with undiagnosed pancreatic cancer. Introduction. Patients with malignant disease need to be vaccinated against COVID-19 because they are more vulnerable to contracting the disease than the wider population due to their multifactorial cause of impaired immunity, and because these patients have a more severe clinical course and therefore increased mortality. AstraZeneca vaccination is known to cause vaccine-induced thrombocytopenic thrombosis, characterized by thrombocytopenia, thrombotic events, and a positive ELISA test for antiplatelet factor IV antibodies. Authors report disseminated intravascular coagulation and cerebral thrombosis in patients 12 days after AstraZeneca novel COVID-19 vaccinations. There is also a description of arterial cerebral vascular accidents in the context of VITT. The authors discussed 2 patients with pancreatic cancer and non-thrombocytopenic arterial CVA, which occurred after receiving the AstraZeneca COVID-19 vaccination. General practices in the Noosa area commenced administering AstraZeneca vaccinations in April 2021, and these cases with CVA have been registered since May 2021. Cases. Pancreatic cancer patients have an increased risk for thromboembolism, and we postulate that the administration of AstraZeneca increased this risk. This study presents 2 patients with pancreatic cancer who developed catastrophic CVAs with a normal platelet count shortly after receiving the AstraZeneca vaccination. Case 1, WC, was a 94-year-old male who developed multicerebral and cerebellar infarcts 24 days after receiving the first dose AstraZeneca vaccination. He was in sinus rhythm. His platelet count was 157, D-dimer 48.9, and the ELISA test was negative for antibodies against antiplatelet factor IV. He also had pulmonary embolism. Case 2, WR, is a 72-year-old male who developed a right-sided middle cerebral artery CVA 30 days after receiving the first dose AstraZeneca vaccination. He was in sinus rhythm. His platelet count was 411, D-dimer 7.06. He also had bilateral DVTs. Discussion. Post-AstraZeneca novel COVID-19 vaccination thrombotic events can involve both the arterial circulation and the venous circulation. The authors are concerned that VITT is not the only clinical condition related to hypercoagulability post-AstraZeneca novel COVID-19 vaccination. Patients who develop thromboembolic events in either venous or arterial circulation after AstraZeneca novel COVID-19 vaccination should be investigated for malignancy. The authors suggest pharmacovigilance related to thrombotic complications of AstraZeneca vaccinations in oncology patients.